most times community pharmacists find it difficult to find DPP because, if you're working in the hospital, there will always be an arrangement for maybe your senior colleague or your departmental head to kind of supervise you. But most times for community pharmacists, it's always tricky trying to find, or even locum is always difficult trying to find a DPP. But if you explore outside of your area, outside of your working environment, you will see DPPs. A lot of doctors don't even know about pharmacists prescribing, and they can supervise you. If you approach them, explain to them what it is all about. Some of them think it's something that that will take ages. If you explain that they don't need to do much, it's basically supervising you, signing off your assessment and all that, and it's roughly 6 months, so it's not like they're going to do it forever. Try to explain what the whole course is all about. They will be willing to supervise you. If you're doing something like a minor ailment, you can do it in urgent treatment centers. So all those out of hours GPs, pharmacists, nurses there, midwives or anybody, they can supervise you. They can be your DPP. So don't just wait for surgery or for hospital, or even let it be where you're working. It must not be in your place of work. It can be outside there. Even specialist clinics, private clinics. What the law says, as long as the person is actively prescribing for 3 years, they can be your DPP. So don't limit yourself to just your working environment. So paramedics as well, as long as the person is actively prescribing for 3 years, they can be your DPP. So you don't have any excuse anymore to say you can't find a DPP. Go around, ask questions, approach people, and try to explain what the course is all about, and you find a DPP. Another thing is that your DPP doesn't have to be an expert in your scope of practice. So if you want to do diabetes, for instance, the doctor or the nurse or the pharmacist that is going to supervise you must not be an expert in diabetes. So they can be an expert in any other thing, and your scope is entirely different from their own scope of practice or whatever. It doesn't really matter. So as long as that person is a prescriber, they can guide you. I mean, it's fine if you want to do a scope related to what your DPP is good at or is specialized in, but if it's not the same, it still doesn't matter. As long as you'll be able to see patients that around your scope of practice within your training environment, is absolutely fine. So the person supervising you must not be an expert in what you're doing. I hope this was useful. Drop any questions you have in the comment section and I will respond to you as soon as possible. I also do want to subscribe to my channel for updates like this. Thank you.